Hi, welcome to Sketchy EBM. My name is Anthony Crocco.
My name is Alison Fox-Robichaud.
Today we're going to be talking about sexual abuse awareness and prevention, sensitive professional practice approaches.
We would like you to know that today we're going to talk to subjects that have serious impacts on those we look after and those we work with. It's important to know that as a regulated healthcare professional, your college encourages the reporting of abuse allegations and has established procedures to manage these allegations. Additionally, facilities have a duty to report sexual abuse. HHS takes allegations like these very seriously and is committed to providing sensitive and respectful support to victims throughout the process. As a regulated healthcare professional, we are also required to report incidents of abuse, and if you are not regulated, you can still report. It is good to know that reporting is mandatory. However, including patient identifiers requires their consent.
What we're going to speak to today applies to all staff, physicians, and learners. First, we want to give clarity around what we mean when we say sexual abuse and who is considered a patient.
We define sexual abuse as having happened whenever there has been physical sexual relations, touching in a sexual manner, behaviors considered sexual such as suggestive body movements, sexual remarks, or creating sexually suggestive environments such as pictures or social media.
How we define sexual abuse in our organization is broader and different than the criminal act of sexual assault, which refers to a sexual act without consent. We consider sexual abuse to have occurred even if the patient has given consent. We need to understand that how we interact with different patients can be experienced differently depending on their past experiences, which may include surviving abuse. Knowledge and awareness of those at risk should inform our care approaches. This can reduce circumstances that may create further risk. For example, avoiding mixed gender room assignments or opposite gender care providers. It's important that we focus on the impact our behavior has rather than on the intention behind that behavior. So what is considered a patient?
A patient is anyone who the healthcare professional has had a clinical interaction with, who has received healthcare services from, who has made a healthcare recommendation, or has given advice or has prescribed medications or treatments to. These durations vary depending on the specialty and the interactions. One of the reasons we consider a broad definition of patient in this conversation is the position of power we hold by virtue of the knowledge and skills we have, the access we have to personal health information, the access we have to intimate care procedures, and that we are in a position of authority. Maintaining a professional boundary around our professional relationship with the patient helps to ensure safety for the patient, as well as keeping the focus of our interaction on their well-being.
So here we have it. Something from the first list being done to someone on the second list is sexual abuse.
It's a good idea to know some of the early warning signs that foreshadow possible sexual abuse.
These include discussing personal issues with a patient, keeping secrets with a patient, providing your personal contact information to a patient, using social media to communicate with a patient, giving gifts to a patient, changing assignments to preferentially be with a patient, or paying special attention to a patient beyond care provision.
So how can we make people safe and in control when we are interacting with them?
In my clinical job, I work with children in the emergency department. One of the standard things I do with my patients is to let them know everything that I'm doing before I do it and what to expect. This light is called an otoscope. It needs to go in your ear. It doesn't hurt, but it does tickle. It's important you don't move. This is my stethoscope. It goes on your back. It's cold. I do this because my job becomes so much easier when children feel safe when I'm looking after them. Some of the same things I do to make my life easier working with children also applies to adults too.
Since one of our goals is to ensure that patients feel safe and in control, we can optimize this by getting consent if you're doing an exam or a procedure, informing patients that we can stop, allowing time for the interactions, being aware of potential triggers, such as exposing the chest, private areas, any touching items in or near the mouth or genital-rectal areas. Be respectful of differences in the patient's cultural background, sexual orientation, gender identity, and any physical or intellectual differences.
Essential to helping patients feel safe is communicating well with them. Several elements that can help with this include being aware of the communication style and needs of others, introducing ourselves and anyone working with us, including names and roles, explaining procedures carefully, using appropriately understandable language, getting consent prior to any touching or intervention while making sure the patient knows we can stop if needed, speaking directly to the patient while maintaining culturally appropriate contact, encouraging questions from patients and families, providing ongoing reassurance and explanations throughout, asking for consent for learners or other observers to be present during an exam or procedure, and refraining from making any suggestive or inappropriate comments.
As part of our clinical assessment or management, we often have to touch patients. We should work hard to minimize any embarrassment, distress, or fear they might experience during these procedures. A few points that can help with this include getting consent prior to any touching, allowing the patient to disrobe themselves if appropriate and able, and only touching areas required. Respecting personal space, providing the opportunity to have someone present during the interaction. Avoiding placing instruments or equipment on the patient, working to ensure we maintain dignity during the procedure, such as staged draping.
Since we never know how a patient might respond to our physical exam, it's a great idea to set a standard of interaction that minimizes risk that we unintentionally cause harm. One acronym that reviews what we've talked about is Be Aware.
Be aware of possible triggers for a patient, explain procedures carefully using appropriate language, ask for consent prior to touching and at every stage of the exam or procedure, making sure they know they can stop at any time. Who might need to be present to support the patient, especially for intimate exams or procedures. Allow patients and families to ask questions. Respect the patient's cultural diversity, sexual orientation, gender identity, as well as any physical or intellectual differences. Ensure that patient's dignity is maintained throughout the interaction. We all play a role in keeping our patients safe and are professionally and ethically responsible to prevent and report concerns about abusive behavior.
This includes telling someone if they have unacceptable behavior and that it needs to stop, documenting events, keeping copies of any letters, memos, emails, faxes, etc. pertaining to your concerns, immediately reporting concerns to your direct supervisor or delegate, even if you're not sure it's a reportable incident. And if there are concerns that involve minors, we have a duty to report to the Children's Aid Society.
If a patient informs you of an abuse, it is important to listen calmly with an open mind, take the concern seriously, reassure the person they are not to blame and not alone, involve the appropriate supervisor while respecting privacy, be supportive, use the Be Aware tool.
It's important to not make light of the situation, assume that the crisis or concerns have passed, try to explain or justify any behaviors or label them as misinterpreted, promise quick fixes that cannot be met, react with shock, disgust, disbelief, or embarrassment, or ask what they did or said that brought about the abuse.
HHS has a number of relevant protocols that help to protect our patients and their families and our staff from concerns of inappropriate behavior. Some of these are listed here.
We hope you found this video useful. Thank you for watching.